Hi, I'm Xana Rapp. This is Caps for Capstone, and the teacher's Professor Mueller. And today I'm going to talk about how mental health and the internet interact in a positive way. But let me preface this by saying with taking any content, especially about mental health, it needs to be vetted and you have to be critical. You also have to be critical with mental health professionals and books written by experts, but it is harder to vet content on the internet. For me, the information I've gained through the internet has helped me more than 5 mental health professionals. One of the reasons why is because 4 out of the 5 mental health professionals I saw, I was going to as a minor with previous suicidal tendencies, and throughout those professionals, I dealt with both an eating disorder and self-harming. Due to that, I was considered high risk, which gave those 4 therapists a pass to use the minor confidentiality rules to tell my parents really whatever they wanted to. This is backed by multiple studies that have shown that the rules guiding psychotherapists for the disclosure of confidential information are unclear. These findings failed to pinpoint a common denominator to explain the manner in which professionals handle information that may demand a break in confidentiality, showing that therapists don't have a system or a line in which they decide to break confidentiality, which some decide to use this as a gray area to tell parents or guardians of minors things they were told in confidentiality without the patient's consent. As well as in my experience, every minor I know who went to therapy, the therapist took extra liberty in telling the parents or guardians things that were told to the therapist in confidentiality without informing the patient, and telling the patient that they didn't tell their parents those things, thus breaking the trust between patient and therapist. The other main problem with mental health professionals and personal bias is personal bias, both in their own competency and in misinformation. In reference to competency, in a study with a multidisciplinary study sample of mental health professionals, respondents were asked to A, compare their own overall clinical skills and performance to others in their profession, and B, indicate the percentage of clients who improved, remained the same, and deteriorated as a result of treatment with them. The results indicated that 25% of mental health professionals thought they were in the 90th percentile among their peers, and none viewed themselves as below average. Further, when compared to the published literature, clinicians tended to overestimate the rates of client improvement and underestimate the rates of client deterioration, showing that mental health professionals genuinely believe they're more helpful than they actually are. In the case of mental health professionals and misinformation, at times therapists believe in things like taking away a person's phone is always beneficial to their mental health, or meditation is beneficial for everyone, which both are blanket statements which aren't backed by facts. But professionals can be helpful for people who go to them. They exist for that reason. They do help people. There's been many studies done to the benefits of talk therapy on mental health, on medications, and mixtures of the two. Which greatly improve patients' qualities of life and personal relations. Child psychologists and therapists are crucial in cases of child abuse, as well as for all ages of abuse. This can also help any person who just needs a guiding hand or to deal with stress. There are many reasons to seek out this help, and professionals do help these people a percentage of the time. And this help has extended onto the internet, as there are now therapists who conduct their sessions through video calls, voice calls, and text chats. This opens a larger pool of mental health professionals who may specialize in certain conditions or situations, such as schizophrenia and LGBT youth. The Trevor Project is one such organization which specializes in LGBT suicide prevention and therapy. The Trevor Project is also an example of where you can get remote help through their website or their call line. In my experience, all of the people who utilize remote help have been willing and active in their mental health progress. To me, that's the most important thing, to be willing to help yourself and having individualized help. In my experience, the greatest benefit from mental health content online is that it can give you the tools to help yourself that can be individualized by you for you. Though through the internet, you can find what is going to work best for you and not what others think will work best for you. You will be able to take your health in your own hands and not feel forced to focus on or work on something you find unimportant or not as urgent because you decide the priority and what you're working on, towards, and through. You can move at your own pace with no pressure of someone's expectations weighing down on you, as well as it is completely as private as you want it to be, which in cases like sexual abuse or child abuse is exceedingly important. But all of this is based on the individual who needs or want mental health. And an in-person therapist could be what helps them, or it could be like me, where self-help on the internet is what worked. In the end, a happy mix of the two is probably best.